I am Enric, as Benoit said. I'm currently working on Creu Blanca. That's a group of medical centers in Spain. And I've been implementing Odoo for our companies over the last 4 years. We started the project on 2017. And well, right now we've done 2 migrations and we are currently working also on OCA, proposing several modules and so on. When we want to talk about the hospital and Odoo, first, I think it's necessary to present what we are. We are a company or a set of companies that have been working 70 years. We have 1 hospital and 5 medical centers. We attend 350,000 patients every year, and we do 800 studies every day. It seems that it's not too much, but 800 studies, it's a lot for only 6 centers. I mean, usually a hospital has like 2-3 MRs, magnetic resonance. Sorry? 800 studies is a lot because it's hard to manage so much information. As each study, it's like 2, 3, 4 gigabytes. Also, we are 250 employees, and outside of our employees, we have a set of professionals, of doctors, like 600, that they work with us. I mean, we don't have the doctors as employees, and they usually work on several hospitals. So, before talking about Odoo and hospitals, we need to understand that a hospital is not a usual company. I mean, usually all companies, all their systems goes around the ERP, and usually it manages most of our business activities. And usually, when we create a ERP, we do it, we focus all our information and systems around our customer. But it is different on a hospital because a usual company must focus on one person every time. It's our customer or company, it doesn't matter. But on healthcare, we have 3 players in this side. We have the patient, the prescriptor, and the payer. And the payer, what's the definition of a customer, but we don't create our systems thinking on our payer. We do it thinking on our patient, because it's the person that receives our care. And patients, one of the problems they have is that they don't really have their free will there, because the choice of the service that will be done and where it will be done is not.
Excuse me, Enric.
Yes.
We see your screen, but it's a Odoo log.
Okay. Thanks. Just 1 second. Okay. Share. New share. Now?
No, it's still the same page. It's Odoo logs.
Let me do something.
Maybe.
Do you see something?
Yeah, but okay, it's good. But it's not the, yeah, okay, it's perfect.
Now?
Yes, perfect.
Sorry. Well, sorry. I was here. Sorry. Well, what I meant is that the patient doesn't really choose the services that are done. So the center of our system doesn't have free will. So we must focus on our patient, but we also need to focus on the prescriber, and the payer. That's the people that will really choose where the service will be made. Also, one difference that's also relevant is that usual companies focus on the future of on future. I mean, we are thinking at what will we sell to our customer tomorrow. But on healthcare, we need to focus on history, because the choices we make are really are defined by our history. The first thing a doctor asks when a patient comes to make a visit, it's what happened. Not what will you do. No, it's what did you. We are thinking what happened, not what will happen. So usual companies focus on ERPs. Healthcare companies focus on HIS. HIS is a health information system. It's a standard system that will manage all our hospital. But ERP is important too, because we need to pay bills, we need to manage products, we need to do a lot of things, but it's not the center of our system. So how do we integrate these two systems? Because they are both important and they need to relate somehow. Because when we do a service to our patient, we need to make a bill. When we consume a medication, we need to modify our stock and so on. So the problem comes on how do we manage them together. Lucky for us, there's a new standard defined on 2014 from HL7 that's called FHIR. It's written like FHIR, but it's called FHIR. It defines 5 levels of information. That's like foundation, support, that it includes the implementation, security, conformance, codification, and exchange of information. But the important part is the 3 on the right. It's administration data, healthcare data, that's clinical, diagnostics, medication, workflow, and financial, and for last, reasoning. Reasoning is the part that will help you choose what will you do with the patient with your old data. It's usually when you introduce artificial intelligence, we don't expect to be there right now, but we can use the previous parts. So I would like to show you HL7. It has a lot of information, but the good part there is that when you enter on a model, you can see what's the information that a patient should have. With this, it's really similar to a Odoo model, and you can translate this HL7 models to Odoo models, and you can start working from this part. So, for example, a patient needs an identifier, a field for active, a name, a contact information, a gender, a birth date, and so on. And if you check it at the end, it's similar to a partner. So how they fit? Well, when we check the information from HL7 and Odoo, we see that all the financial data is proposed on the ERP, and it really matches our Odoo system. Also, as we need to manage our financial data, we need to store a lot of information also on Odoo, like patients, practitioners, services, payers, and so on. And all, if we check also, we can see that there's some synergies between medication and stock, as a medication, an administration of medication will produce a stock move. So starting from this, from HL7 Fire and checking how Odoo was managed, we decided to use Odoo, and for several reasons. Mainly because it was easy, it could be easily developed, and had a great community. So we could manage a lot of things easily, and only implement specific parts from healthcare. So we defined something like that. Let me explain somehow. We defined the ERP using Odoo, and now we can see some modules from the HIS. Okay, the EMR, that's the part that it's really integrated with Odoo. It's the electronic medical records. It's like when a patient does an MRI, it's created a record, and so on. If a patient does a visit or something like that, we create a medical record. Some of the medical records were necessary to be on Odoo because they generated some charge billings, stock moves, and so on. So we defined them on Odoo. Some part of these records, like histories or something like that, is not implemented, where we didn't implement it on our first approach on Odoo. The other parts that we can see there, it's the RIS, Radiology Information System. It's the system that creates the reports for radiology. Modality word list, it's the communication from our system to our machines, like an MRI, a CT, an echo, US ultrasound system, whatever. We didn't did this modality word list on Odoo, but integrated with Odoo, because when we decided to make something like an MRI, we said, okay, we communicate with our machines and say, you will attend a patient named Enric, and so we need to communicate all this information to our machines. So we do it with the modality word list. The packs, it's the storage of all the images. It's really, it's usually a big system with a lot of storage, and it's not really images, because we don't store images. We store something different. It can be translated to images, but it's not really there. It's not always an image. The LIS, it's the laboratory information system. For the same reason, we only integrate because we don't have a laboratory. Because the laboratory, it's an external company, it has no relation with Creu Blanca. And so we only communicate with them. You will attend a patient, and we need these protocols, these parameters, and so on, but nothing more. We don't manage the results, and so on. And last, our scheduling or appointment system. It's like when a patient calls and say, okay, I want to do a visit with some doctor. We need to manage this scheduling. And we didn't make it on Odoo because we already had a system that worked fine. So we decided to make a small approach on the first, at first. So what happened with that? Okay, then we had a better integration because there was no duplication of data. When a process created something like a visit with a doctor, the systems were integrated, we didn't have to communicate to all of them. So administration data was already knew that this patient was attended. So no administration or no practitioners had to write on both systems. But the bad thing is that we were splitting data, as at least like administration data was on one side, medical data was on the other. And at the end, users sometimes had to access both because on surgeries or something like that, usually the payer expects that we communicate exactly how the surgery went and so on. But at first, as a first approach, it was functional, and we are currently working on this. But we want more. What are we working now? We are defining. We decided to integrate the RIS and the EMR completely on our ERP. What does it mean? All diagnostic reports are managed by Odoo. The studies also stored on the packs can be accessed from Odoo. The list, as the company is external, we didn't integrate it, but with the current system, most part of the list could be managed by Odoo. The scheduling, it will be done sometimes, but not right now because, as I said, we have a functional system. It's really good for us. So we decided to keep it as it is right now. So what's the benefit of our new approach? We have a real patient-centric system, as all data goes around our patient. We have a single point of information. We need to be sure that every user only can see what he can see, but Odoo manage that. And we have no more splitting of data. So it's good for us. That simplifies our systems because we need less integrations, and also increases our innovation speed. I mean, before we worked with Odoo, doing a change was like months at least. Any change, right? Right now we are talking about days or hours, because Odoo allows us to do a lot of improvements, sometimes by programming, or sometimes with only looking at OCA and decide if we need some extra modules. This approach, we are currently working on that. We have managed some of them. For example, we can create medical diagnostic reports. We also integrate with external machines. So when a laboratory system makes an analyzes a blood sample, he can communicate with us and we can create the report. We integrated with the packs, and also we are managing our internal requests. What we will do now, we will try to create medical health histories and episodes of care, manage all nursery, and accessing studies and so on. We are trying to make Odoo our full our system that's fully integrated, and that's and allows us to work properly. Let me show some of our work. No, this one is better. So, for example, just 1 second. I close it. The Odoo. We can define complex reports like this one, like an audiometry. Our user only defines the values, and then it's graphed correctly on the report. We can also make just 1 second. Generate a CT, and when we import a study, the study should have imported all the images. Maybe it will take some seconds because it takes. No, because this study it's empty, but we could import all the images here. We could, sorry, I used a CT, not a US. Echography right now. Now it's downloading all the images for this study, and when we are printing it, we can see all the images that related to this study. We can do reports that are managed with values, like how many red blood cells were, millions of red cells for microliter, or the percentage of hematocrit, and so on. But we could also modify, just 1 second, its composition. When we are defining a US, for example, now an echography, now we can show how it went. Patient with normal range of I don't know, whatever. I mean, we can do a report. Also, we can issue that, so it's fixed and cannot be deleted. We also made a system to verify that the record was not modified. It was a security concern that a report that was already done could not be modified, and so on. We are already using this on our production system. For example, for doing the antigens for COVID, or doing audiometries. That's a report that shows how is your hearing, or even sorry. And also, how is your how are you seeing the visual acuity? So here we can see, okay, this patient from far, it's not seeing really well because it's on the bad side. Also on the near, because it's on the slow part. So our patient that sees correctly should have an 8, 9, 10, or so on. And that's for one example. Also, some of our practitioners are using them to inform MRIs, CT scans. We are working to do echographies and so on. So it's a system that allows us to make reporting. But not only that, we are allowed to do some planification. I mean, for example, well, it's in Spanish, sorry. But when one patient wants to do a body MRI, a magnetic resonance for body, it's launched automatically a word list with our MRIs, a task for our doctor to do a report, and this is for creating a label to scanning the request from the external practitioner. Because with this label, when we scan the label, we integrate it automatically in our HIS, for example. But like that, we did a lot of things. And that was managed because we could integrate correctly with FHIR. Second. So all these repositories are currently on, all this information or modules are, most of them are open source, but they are not on Vertical Medical from OCA, because there were some issues some time ago when we started working there. So we decided to start from scratch on our repositories. We are open to share them on OCA if we can find some people interested and synergies with other developers, because we don't want to make it only for us or start selling this, because we are currently a hospital, not a developer. So if anyone has interest in this kind of modules, feel free to ask us and we can work on this. Sometimes we talked, but at the end there was not really interest there, so we didn't integrate it with OCA, but it's also easily integrated. And I think that's all. Sorry for the first 10 minutes that were no screening. Sorry for that.
Thank you, Enric, for the talk. I have a question. Where can we find the module?
Yes. Well, we have like three repositories. Okay. Because we decided to split them on three in order to not cross too many information, because sometimes we did some implementation that were specifically for us. They were made open source because they had sense, but we didn't know if it was currently following the standard. But we made a medical FHIR on Tigin. That's the core modules that defines like diagnostic report graph, how care plans, and so on. And then we have two more repositories, CB Medical. That's some standard, like how you manage documents and so on, that it has some differences with the standard, and we were not sure if they could be there. But, well, it was our opinion. And also, well, there's another repo, but it has like accounting modules and so on that are used here, but then they are not really medical modules.
Thank you. And do you base some of on top of some native Odoo modules, or not? Is most of it is like
No, we try to use Odoo modules as where we could. Like, we are not creating patients, we are reusing partners and so on. We tried to make sense with all the information. Some of them had to be done separately, but at the end, when we tried to make the relation between the medical system and our accounting system, we passed through sales. So we translate our medical information to a sale order or several sale orders, and so on.
I see. Okay. If someone has a question, you can put it in the chat.
Feel free.
Yeah. So no question, I think. Thank you very much for your talk. It was very interesting. Maybe one question is
yes, when someone asks for the link.
Mm-hmm.
Okay.
It was to me, so I will put it in the general chat.
As said, if someone is interested, feel free to contact us, and we can propose these modules to OCA if there's some interest there. I mean, if... Oh, sorry, I sent it to you privately.
Yeah.
Ouch.
No problem.